Hi, good morning everyone. My name is Deepthi Soni and I work as the Associate Director for Bharati Institute of Public Policy at the Indian School of Business. And it is with great pride that I invite you all to the second edition of the Public Policy Dialogues, the theme for which this year is human development. The Public Policy Dialogues is not just an academic exercise but a call to action. It is an opportunity to examine India's distinctive challenges, sharing innovative solutions, and fostering partnerships that may catalyze change. Our discussions here will echo far beyond the walls of the ISB, influencing policies, initiatives, and collective efforts to enhance human development not just in India but around the world. Our nation is at the forefront of addressing critical issues such as improving learning outcomes in schools, tackling institutional challenges in social development, striving for healthcare for all, mitigating climate change, fostering livelihood, diversification and enhancement of skills, and improving nutritional outcomes for millions. And against this backdrop, our conference emerges as a crucial platform for dialogue and action. We recognize that India's journey towards holistic human development is not a solitary endeavor but a global responsibility, as was very evident in the just concluded G20 presidency. The collective wisdom and collaborative spirit of our participants holds the power to shape not only India's future but also influence the global discourse on human development. A host of discussions, roundtables, innovation sandbox, and poster presentations will be held during the course of these 3 days. India is a beacon of hope and resilience with a vibrant democracy and a diverse population committed to realizing the vision of a better tomorrow. ISB's Public Policy Dialogues 2024 seek to amplify this commitment, celebrating the enduring spirit of India and its role in addressing the pressing issues of our times. And with this, I would now like to invite on stage our keynote speaker, Padma Bhushan Dr. K. Srinath Reddy, Honorary Distinguished Professor at the Public Health Foundation of India. Shri Amarjeet Sinha, IAS retired and a member of the Public Enterprises Selection Board. Professor Ashwini Chhatre, Executive Director, Bharati Institute of Public Policy. Dr. Arushi Jain, Policy Director, Bharati Institute of Public Policy, and Dr. Anjal Prakash, Clinical Associate Professor, Research, Bharati Institute of Public Policy, for lamp-lighting ceremony to traditionally open the dialogues.
ॐ भूर्भुवस्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो नः प्रचोदयात् ॐ भूर्भुवस्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो नः प्रचोदयात् ॐ भूर्भुवस्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो नः प्रचोदयात्.
Thank you everyone. Thank you Professor Anjal Prakash. You may now alight the stage please. And may I please request Dr. K. Srinath Reddy, Shri Amarjeet Sinha, Professor Ashwini Chhatre and Dr. Arushi Jain to take their seats on stage. Thank you. To To continue, I would now like to invite Dr. Arushi Jain, Policy Director, to deliver the welcome address. Dr. Jain has almost 2 decades of experience as an administrator, faculty and project head. In her current role, Dr. Jain leads on education, special projects and outreach activities at the Bharati Institute of Public Policy. She holds a PhD in Social Sciences and Masters in Public Administration and Human Rights. She is a visiting faculty at several premier institutes, including the Lal Bahadur Shastri National Academy of Administration, or Labasana as commonly known. She is also the series editor of the ISB Rutledge Policy Book series titled Innovations, Practice and Future of Public Policy in India. Dr. Jain, please.
Thank you, Deepthi. A very good morning, everyone. A very warm welcome to all our esteemed speakers and delegates to the Public Policy Dialogues. Welcome to Public Policy Dialogues 2024. I think we couldn't have had a better start to the new year than having this kind of an academic deliberation focusing on a very imperative aspect of human development. On behalf of the organizing committee of the Public Policy Dialogues, I extend a very warm welcome to our distinguished keynote speaker, Dr. K. Srinath Reddy, Padma Bhushan, Honorary Distinguished Professor and past President of the Public Health Foundation of India. Dr. Reddy, it's a true privilege to have you here as the keynote speaker of the Public Policy Dialogues 2024. It's also a very proud privilege, and we extend a hearty welcome to Mr. Amarjeet Sinha, former Secretary, Rural Development, Government of India, and former advisor to the Prime Minister, who is currently the member of the Public Enterprises Selection Board. Mr. Sinha is also the chair of the Public Policy Dialogues Advisory Committee, and we welcome you, Mr. Sinha, to the dialogues. We are truly delighted to have on the stage our very own Professor Ashwini Chhatri, the Executive Director of the Bharati Institute of Public Policy, who is the conference chair and a beacon of guidance for all of us. The focus of this dialogues this year is on the multidimensional nature of human development, which integrates economic growth, social advancement, and sustainable practices. Human development is about expanding the people's choices and enhancing the capabilities to enhance their knowledge, health, a decent standard of living, and participation in the decisions affecting their lives. In India, while economic growth, education access, and healthcare improvements have been focused to quite an extent, the issues like income inequality, gender disparity, and environment sustainability require attention and policy interventions. This is what the dialogues is going to deliberate on, and we have with us varied experts today who are going to talk about education, health, nutrition, climate action, institutional challenges, and all the related aspects during these 3-day dialogues. We welcome all our speakers for the Public Policy Dialogues 2024. We have delegates who have registered from various parts of the country. These are policy enthusiasts, people working as practitioners, as academics in the policy domains, and also students of public policy from various institutions. We welcome all our delegates to the Public Policy Dialogues. We trust you will find the sessions enriching and the discussions insightful, and we also extend a very hearty welcome to the media who are here with us, the representatives of the media from both the print and digital who are here with us. And because these sessions are getting live streamed, we have a lot of audience connected with us on these live stream sessions. So a very warm welcome to all our audience of the Public Policy Dialogues 2021. We hope you enjoy the sessions and you get the most of it. Thank you one and all.
Thank you, Dr. Jain. I think some of us are feeling a little cold, so maybe we should clap harder to feel a little warmer. Thank you. I would now like to invite Professor Ashwini Chhatre, Associate Professor and Executive Director, Bharati Institute of Public Policy at ISB, and also the driving force behind the dialogues for setting the context of the three-day crucial sessions. Professor Chhatre is an interdisciplinary scholar with his research interests broadly centered on the dynamic cross-scale interactions between governance, economic development, and environmental protection. He was awarded a PhD in political science from the graduate school at Duke University. Professor Chhatre was the first Georgia Ruffalo postdoctoral fellow in sustainability science at Harvard University in 2006. He has spent more than a decade working in different parts of India, mostly as a community organizer and social activist working on issues related to natural resources like land, forests, and water. A background in economics, graduate training in political science, and long-standing engagement with scholarship in geography, anthropology, landscape ecology, and environmental history ensure that Professor Chhatre's research will never be confined to a single discipline. Professor Chhatre, please.
Thank you, Deepthi. I will follow Arushi in welcoming all of you, including those of you who are either delayed at the airport or been witness to the fragility of our economy, to a change in criminal laws, bringing the country to its knees in 1.5 days of a strike. These are very interesting times that we live in. It is, in more ways than one, a spectacle of public policy that we are living through, sometimes on a day-by-day or an hour-by-hour update. I want to take this opportunity to give you the context within which the conversations over the next 3 days will take place. Of course, there is a history to everything, and there is an important background to this edition of Public Policy Dialogues. There are two motivations that you might be able to discover and decipher in the events that follow. The first is the focus on human development, and you may notice or even wonder why it is not sustainable development. We deliberately want to go back to basics. 17 sustainable development goals are good, but perhaps too many, and not all goals are created equal. Some are more important than others, some are more fundamental than others. It's important to remind ourselves that learning outcomes in primary education, nutritional outcomes during early childhood, and health care for all are far more important for long-term development, sustainable or otherwise. We want to explicitly bring our own attention to these challenges that are unmet. We have not failed, but we have not succeeded either. And certainly there is not much cause for either celebration beyond small joys that we can snatch occasionally in some geographies, in some times. Human development continues to be a challenge even when we don't talk about it. And I want you to take human development more seriously. This is not to say that everyone who will be speaking here, who is a participant in some form does not care about it. But we need to collectively remind ourselves how important human development is. And of course, like love, it is a many-splendored thing. Artificially, we have divided up human development into 6 themes. I myself do not agree to this division, but I cannot come up with a better one. In order for us to organize our conversations, it is important for us to focus on a small part of the big picture at any given time. But hopefully we have also organized the conversations over the next 3 days meaningfully enough for it all to come together, for each one of us to be able to build those bridges, to borrow those insights from aspects that we either don't fully understand or are not fully committed to. In our copious spare time, and everyone who is even remotely competent is overcommitted. In our copious spare time, if we are able to hold even a few conversations with someone who is not a clone of ourselves, it is an expansion of our horizons. And I sincerely hope that the design of the public policy dialogues enables each one of us to push our own horizons just that little bit, to meet 3 new people who work on things that I don't work on. At my age, not very advanced, but still, it becomes important to take deliberate action to step out of what we are committed to do, what I am very comfortable with doing, things that I can talk about for hours in my sleep. And human development is one such object. It cannot be nailed down. It cannot be solved, not in my lifetime, at least for a country like India. So it gives me a challenge, not something that I can accomplish in my lifetime, but I can find camaraderie, I can find a cohort, I can find a group of like-minded souls who are engaged in their own grasping at different parts of this elephant. All of us are blind, but the awareness that we are blind and we are grasping at an elephant is, I think, a meaningful first step. Not bad. We do get carried away, we do get sidetracked. We have been talking a lot about sustainable development. I would like to urge you to consider stepping back and restart talking about human development, about education, about health, about nutrition, about fundamental challenges that are civilizational in scope, like climate change, that will affect everything, and the institutional challenges that must be solved before any of these other outcomes can be achieved meaningfully in a way that will continue to produce good outcomes. So we are, of course, at a place where looking into the future is extremely important. So that is the first motivation, human development, to refocus, to find this cohort and to expand our horizons without compromising on that. The second motivation is the depth, the breadth in fact, but also the depth of experiential and practical knowledge that already exists. It's not like we don't know how to create large-scale impact, how to improve learning outcomes at scale, how certain geographies have been able to improve nutritional outcomes, move the needle that seems to be immobile. And a lot of this is, of course, the result of of blood and sweat and tears of many of you that we would like to bring to the center stage. This knowledge that currently resides in practice must be made available in a form that can be translated into policy. That is where the combination of institutional challenges and practical knowledge must be overcome. One theme, one issue, one problem at a time. It's not a small challenge, but why would we want to do something that is easy and simple? We have a lifetime to achieve it. We have a next generation of scholar practitioners to train, to motivate, to inspire, to carry on this work, because it will not be over by the time I die. I want to end with Ghalib, a source of my inspiration quite often. ताफिर न इंतजार में नींद आई उम्र भर, आने का अहद कर गए आए जो ख्वाब में. The best dreams are those that keep us awake at night. We all are driven by these dreams, no matter how small or narrow they may feel to us. But by pooling our dreams, we don't only dream big, but we also make it possible for dreams to come true. Let this be the start of that journey. I welcome you all, and I look forward to talking to you and expanding my own horizons.
Thank you, Professor Chhatre, and I'm quite sure that all of us in the audience would quite agree to the elephant analogy, and that, even in today's strongly hyper-connected world, we are still seeing different parts of the elephant and not as a whole. It is with great pleasure I would now like to invite to the podium Shri Amarjeet Sinha, IAS retired and member Public Enterprises Selection Board, for the expert talk on the theme Human Development Perspectives from India. Shri Sinha has over 4 decades of experience and held the position of Secretary in the Department of Rural Development, Government of India, and was appointed as the Special Advisor to the Prime Minister of India in February 2020 to oversee projects related to the social sector. He was instrumental in designing the Sarv Shiksha Abhiyan and the National Rural Health Mission. Among other notable schemes and flagship programs, which Shri Sinha steered, are the Mahatma Gandhi National Rural Employment Guarantee Scheme or MNREGA, Pradhan Mantri Awas Yojana Gramin, Pradhan Mantri Gram Sadak Yojana, National Rural Livelihoods Mission, Gramin Kaushalya Yojana, to name a few. He has published several books and articles in noted global and national publications. Shri Sinha, please.
Thank you, Deepti. Friends, after Ashwini's broad summing up of why we are here, there is very little left to share. But nonetheless, what I will try and do in the next 20-22 minutes is to just share with you why did we need to do work on human development and in the manner that we are proposing. Friends, I'll begin with the Mint view which appeared yesterday. I have sent it to many of you, some of you would have seen, which read, expand India's economy but not as an end in itself. It went on to say, our robust macro data hides a disquieting micro story that should be addressed in 2024. It goes on to further specify, yes, the airports, the infrastructure, the roads make us feel that we are there. But there is that other micro picture which is different. Look a little deeper. However, it is equally clear that we have no space for complacency. For all the progress made in our 75 plus years as an independent nation, we still have a long way to go. So even as we overtake our former colonial masters in economic terms, the dawn of 2024 is a good time for a reality check. On a per capita income basis, India ranks 139th by GDP nominal and 127th by GDP purchasing parity. And even as the proportion of Indians living below the poverty line has fallen dramatically, India is still home to an unconscionable large, perhaps the largest globally number of people who barely meet their subsistence needs. In terms of social development indicators, access to health, education, sanitation, potable water, infant and female mortality, law and order, and we rank below many of our peers among emerging markets. While social indicators in some parts of the country are comparable to those in advanced countries across the swathes of our land mass, they are worse than sub-Saharan Africa in some parts, and sadly the benefits of economic growth and social development have not been evenly distributed across the country. I could go on and on, but this disconnect between the macro and the micro, put very briefly, pithily, that's what brings us here. There is something which needs to be done, something which needs to be done with a sense of urgency, something which needs to be done with a sense of purpose, something which needs to make a difference. The same story, if you read Anirudh Krishna's The Broken Ladder. Yes, there are these youngsters, men and women in villages, schools, aspiring very hard to make it somewhere and not succeeding, or not succeeding as often as they should. How do we fix the broken ladder? How do we ensure that the dreams and aspirations of that government school, however ramshackle, translates into human well-being at some stage? How do we make a difference? The same disconnect of the macro and the micro is what Anirudh Krishna, through his field work in Rajasthan and with some of the other countries, states that he worked in, brings out. Friends, clearly we have challenges. Whether you read Rukmini's work around numbers, whole numbers and half-truths, and the way she sums it up, the kinds of challenges that we face, she recounts a death in a government hospital in Maharashtra in Jalgaon. The mother went missing. People didn't know what had happened to her. The son was living in a distant Bombay. It was COVID times. He couldn't go there. Some days they kept looking for her. Where is she? She had gone to the hospital, but nobody had seen her there after that. 7 days later, there was a stench coming from the toilet, and it turned out she had died having fallen in the toilet itself. It's not just one micro example. We need to fix our systems. What other alternative do we have if not the public systems and making them more credible, whether it is health or education or nutrition? So clearly, when we thought about this whole process and exercise, it wasn't limited to just publishing a few volumes. We would very much like each of them to be an op-ed piece which brings out the micro essence of what is happening. Ashwini put it very well. We want to make use of experiential learning, whether from civil society, from government, from academia, from whichever, from policy makers. What is it that went wrong? Or what is it that is seemingly going right? How do we fix this? What is it that is possible in the space of public policy which can take us to a better connect between the macro and the micro? How do we transform more lives and livelihoods meaningfully? Friends, in some manner, this process we have been at for some time. And again, to illustrate many of our participants, when we thought about these volumes, we always thought in terms of who are these people who've done something different, who've done something, whether an academic or a policy maker or a planner or an implementer, what is it that has happened which makes it necessary to understand that experiential learning? I recall many of my colleagues from the probe report team that Professor Jean Drèze had put together, the public report on basic education. What was common to the 8 authors that they had nothing in common. Somebody was a development economist, somebody was a school teacher, somebody was an administrator, somebody was a teacher developer. Everybody had different professions. Somebody was an activist. But we had come together just to see what schools were like. The release of the book was not like a book. It was released at a public hearing organized in a public place in Delhi with Professor Amartya Sen formally chairing that public hearing. But what it did, it was one of the few books that Oxford University Press published in Hindi as well, English and Hindi both. The intent was to shock that this is how our schools are. But not only to shock, but also to show how Himachal, which was an adjoining state, had managed to do things differently. So in each of these studies, the focus was always on trying to understand where things failed and where it worked or worked a little better. A similar study, the focus study, which was around the ICDS and nutrition, looked at Maharashtra and Tamil Nadu along with some of the states which were not doing well, only to point out what is different in Tamil Nadu. Why has it done better than others? Some questions came to people's minds, and perhaps some of that helped in resolving some of the challenges of this disconnect between the macro and the micro. I can go on and on. In the health sector, the Public Health Foundation, a lot of work that Dr. Reddy and the team were doing around public health, sensitizing how it was important for India to build public health capacity, how it was important to ensure, given the information asymmetry in the health sector, public systems are what will ultimately survive, are what will deliver. The logic for public systems from the time Kenneth Arrow, the Nobel-winning economist, talked about the information asymmetry and the market failures. The need for public systems in health, why can't they be more credible? Why can't we are able to provide better services there? If we can build good roads and airports, why can't we have better government schools and better health facilities and better arrangements for nutrition? Clearly, the answer lies in some of those micro details and micro experiments and efforts made across the country. We have Richard Mahapatra and friends from Center for Science and Environment and Down to Earth here. Richard would recall in their Down to Earth magazine, they used to publish 3 pages of grassroots in every issue, page 22 to page 24. And grassroots were about what is it that is interesting which is happening in the sustainable development space in the country. A lot of those grassroots initiatives threw up large lessons. The state of India's environment, the volumes that they bring out, it helped in building knowledge on a sector on which micro data and micro details were not so well understood in the country at that time. Friends, the motivation for these volumes is primarily to capture that experiential learning, to subject it to good academic rigor, to ensure that when published passes muster with academic scrutiny and also serves in building knowledge at the grassroots level. Everyone says nutrition is important. Everyone says that we have a long way to go. But even before we've settled that, we divert our minds into getting into whether or not the standards are right. There are bigger issues in nutrition. There are larger challenges there. The data which is available with us, how is it that with the same standard, a state like Sikkim makes an 8-point decline on stunting in 5 years between NFHS 4 and 5? If there is so much wrong with the data, how was that ever possible? And aren't we not aware how the data was found? Vandaraji and the team, Deepa, they have done an excellent paper for the Hindu, which I am sure will enlighten many people, that how were the standards arrived at? Yes, children from well-to-do families, well looked after, with no problems or deficits of care, those children in their growth profiles is what is the standard. What is wrong with it? What is wrong in being aspirational with achievable targets at the same time? That's what the WHO standards were about as and when they were developed. So clearly some of these debates, if we have micro studies, a state like Bihar, yes, it continues to have very high levels of stunting, but we also need to realize how it managed to reduce stunting by 5 percentage points between 15-16, the fourth, and FHS in the fifth in 2019. When you went into the details, you discovered the important role of food diversity. Our friends from Jivika movement in Bihar are here today. The work they did on health, nutrition and sanitation, primarily focusing on food diversity and what difference it makes. There are so many of these micro studies across the country. Friends from Maharashtra presenting on the work that they are doing on nutrition. Friends from Meghalaya sharing what they are attempting and they are sure will make a difference. The objective of these volumes is to critically learn from our failures, to accept these as challenges and to share where alternatives or thought processes have helped. We have Sridhar from the Education Initiatives, who's done diagnostic studies in 5-6 states to understand why children don't have the learning outcomes that is expected of them. We want him to tell us what the diagnostic studies indicated, what was wrong with the school system in those states, what needed to be fixed. It's time to get into the nuts and bolts of what will create and craft credible public systems, because it's also a management and an organization challenge. So we are visiting this not simply as research for research's sake. Yes, it must pass muster as research, but must also build a very strong case for crafting credible public systems where they are needed, for regulations wherever we have to engage with the private sector, regulations which again stand the test of time. Dr. Abhay Shukla will be with us from the Jan Swasthya Abhiyan, who will be sharing on some of the challenges of regulation in health and some other sectors, what needs to be done, what needs to be thought differently. So clearly, yes, we are not saying that we should not engage with the private sector, but in doing so, we must know where the boundaries are. We must know where exactly, what are those critical pain points that need attention. These volumes are about these brass tacks, about these nuts and bolts. These volumes also need to be brought together as a whole through the organization and management principles. What is it? It's not just a question of expenditure. From where we were 20 years ago, like the probe report and the probe revisited report in 2006 pointed out, there were more classrooms, there were more teachers, there was more drinking water in school, there were more toilets in schools, but the classroom processes had not changed. How do we get this balance right of governance and financing reforms, federal principles, central, state and local governments working together, community organizations having a role, and developing better? The reason why the 6 volumes in a way are not disconnected. 6 volumes are all interconnected, and 6 is not the end of it. The more good evidence-based studies which add to knowledge, 6 will become 12. 12 will become 18. The process will go on. Because it's very important to capture experiential learning in a slightly dissociated manner, understanding those levers of change. What is it that made the difference? What is it that is that good advice to those who make policies? What change can be brought out to make a difference on how things actually deliver in the field? Friends, from the time the probe report came, the focus report came, the public report on health came out, many other reports have been coming out from time to time. The case for human development, Professor Amartya Sen and the team holding the consultations in Calcutta every year for many years, the issue was discussed broadly. Yes, people started realizing the importance of human development. programs came up and were developed by political parties to push an agenda for education for all, health for all, and so on. Time has come now to look at these micro studies to get a better understanding of what is wrong with the program design, what is wrong with the policy analysis, what needs to be done differently. So we see our roles as building a body of knowledge that can be acted upon, that can actually help governments to deliver better on many of these responsibilities of governance and reform. Clearly, this is only a beginning, and I would like to compliment Ashwini, Arushi, Anjal for this opportunity to work with this institution, to work with friends across the country, and I will be feeling in my duty if I don't thank each one of you who are here. You've taken the trouble to be here at the beginning of a year. People drawn from completely diverse backgrounds. Some working as activists in civil society organizations, some others raising public causes in some corner of the country, yet others policy makers in government, some academics. It's a mix of people here. We want to work together. We want to arrive at certain principles which help us to move forward better, which allow us to understand things better, which challenge conclusions which are not evidence-based. And again, at this point, I can do no better than to just mention what S. Rukmini, in this wonderful book on whole numbers and half-truths, I can do justice to it only by quoting with what she ends her chapter with. Data has been transformational for India. We need to build a future with more and better data that's more widely available and easier to understand. Without it, we are in danger of hollowing out democracy. Look at the sensitivity with which she is written on evidence-based research and data. If we don't allow this tradition, if we don't develop this tradition strongly, we run the risk of doing things wrongly. We run the risk of making faulty policy designs. Clearly, it's important to respect what the field is saying, and I conclude with a very small but a very useful remark that Anirudh Krishna makes in summing up the challenges. As things stand, the state simply does not have the machinery to observe and record the quality of service performance at the grassroots. The presence of the state does not extend into beyond 5-kilometer villages and blue polygon slums. That's the way the state has been constructed. But there is no other than its employees whom the state trusts to observe and report upon performance quality. The result is that the state has no means to keep itself informed about quality standards. Again, something which runs through the 6 volumes. We want to understand what went wrong. Why is it, and he makes an example of Kesho, one of the characters in his book, who unlike his other schoolmates worked very hard to study, became a graduate, but did not manage to secure anything beyond that. When he comes back to go and do the same construction worker's job, the sadness and the remorse in him that it was better if I had not done this educational journey and done what others are doing without education. But he also clarifies, but Keshav was different because he had gone to school. It had made a difference, but in terms of livelihoods, so clearly the demographic dividend, the developed India, the inclusive India, and India for everyone, all these challenges need to build on a lot that we will together be discussing here in this conference and beyond, in putting together in these volumes what is it that has worked, what is it that has not worked. If lives and livelihoods have to transform, if deprived households have to live a life of dignity, human development holds the key to that change. Thank you.
and body of evidence is what we aspire to create over these 3-day intense dialogues and much beyond. Thank you, Shri Sinha. And finally, it is my absolute honor and delight to invite to the podium Padma Bhushan Dr. K. Srinath Reddy, Honorary Distinguished Professor at the Public Health Foundation of India, for the inaugural keynote address. He is also the former president of the Public Health Foundation of India and was the head of the Department of Cardiology at the All India Institute of Medical Sciences. Dr. Reddy was appointed as the first Bernard Lohr Visiting Professor of Cardiovascular Health at the Harvard School of Public Health in 2009 and presently serves as an adjunct professor of epidemiology at Harvard. His contributions to public health have been recognized through several awards and honors, including World Health Organization's Director General's Award for Outstanding Global Leadership in Tobacco Control in 2003, Padma Bhushan in 2005, Queen Elizabeth Medal by the Royal Society for Health Promotion UK in 2005, Luther Terry Medal for Leadership in Tobacco Control by the American Cancer Society in 2009, membership of the US National Academies by the Institute of Medicine in 2005, fellowship at the London School of Hygiene and Tropical Medicine in 2009, and fellowship of the Faculty of Public Health UK in 2009. Dr. Reddy, please.
Dr. Amarjit Sinha, Dr. Chatre, and Dr. Jain. I deliberately am addressing Dr. Amarjit Sinha, not as Mr. but as Doctor, because the Latin origin of the word doctor is one who teaches. And there is no better teacher, as you have seen this morning, than Amarjit Sinha ji. Therefore, very much entitled to be a doctor. And of course, I feel very diffident in coming to the podium after him, after that splendid elucidation that he and Dr. Chatre have given of why public policy has to be both multidisciplinary in scope, but very much grounded in experiential wisdom of communities. Let me start by wishing all of you a very happy new year. And what better than to borrow words from Charles Dickens from his work in Chimes, quote, "So may the new year be a happy one to you, happy to many more whose happiness depends on you," unquote. That is the essence of public policy, because happiness of so many other people depends upon people who both formulate as well as practice public policy. So we recognize that public policy involves policies, systems, programs, and community engagement. Frequently, the community engagement part is forgotten. But that is where we must really recognize and respect the role of communities, not only in responding to policies which are being practiced, but also in generating, firstly, the policies themselves, and then applying correctives thereafter when required. Let me start from a health perspective, where Amarjit ji and I had worked together in 2011 on the high-level expert group on universal health coverage. In the introduction to that report, I had written that what we need is not health insurance, but health assurance. Now, that particular formulation is being used for Pradhan Mantri Jan Arogya Yojana, saying that it's health assurance. Indeed, it's assurance in the sense that it is assured payment to the intended beneficiaries who are described and identified. But there is health beyond health care, and certainly health beyond hospitalized health care. And therefore, when we really talk about health assurance, what is the vision that we must enunciate for health assurance? Obviously, health financing is very central to the effort because resources are needed. And we must indeed increase the level of public financing for health. But it has to be substantially tax-based financing, but also additional government budgetary, driven through the budget, but also government-funded social insurance programs or partially subsidized social insurance programs, other insurance programs which are private or community-based. But health financing is only one component of it. In order to deliver the entitlements that the health financing is now supposed to offer, we need a competent health system. We need an efficient, equitable, and empathetic health system to deliver upon that promise. So we need a multi-layered, multi-skilled health workforce. We need adequate infrastructure at all three levels of healthcare. We need health management information systems which have reliable, timely, and representative data. We need good governance systems. We need an assurance that drugs, vaccines, and technologies are both available and affordable. And of course, we need community engagement. Community engagement was one that was missing in WHO's earlier 6 building blocks of health. And that's where we must ensure that community engagement is brought back very clearly into the picture as well. And that's the intent of this dialogue as well. But even that is incomplete. So if we think of 3 concentric circles, we are really talking about the central circle being health financing, the second circle being a functioning health system, which then delivers upon the promise of universal health coverage provided by the health financing. But we need the other concentric circle outside, which is the entire array of social determinants of health, which act broadly at the societal level in terms of water, sanitation, food systems, physical environment, social stability, but also at the individual level, though that too is socially determined, at the level of education, occupation, income, gender, and participation in social support networks, availability of social support networks. Only when that outer circle is also there to complement the other 2 circles, then we can think of a healthy society with health assurance. So, let me go to the next slide as well. I consider it a violation of human rights to subject people to, to pulverize people with PowerPoint so early in the day, but therefore I've chosen only 2. It's unfortunately the problem of people in the medical profession and particularly even in the public health profession to have too many PowerPoint slides. Social scientists generally desist from that, but I beg your indulgence because I'm only using the second slide again, only for, this is a fuzzy slide of the Sustainable Development Goals, the 17 Sustainable Development Goals. Fuzzy, not only because it's reproduced from a UN publication, but fuzzy also because the progress thus far has been extremely hazy. The UN itself confesses that very little progress has been achieved and there is a lot of ground which is unlikely to be made up before 2030. But this is essentially to point out the various elements of human and societal development which need to be addressed, not as separate numbers, but as an integrated matrix of human development, which is what this particular consultation aims to do. We recognize very clearly that all of these are interlinked, and health and nutrition are linked to all the other SDGs, and bidirectionally in most of them. Whether we are talking about SDG 1 in terms of poverty alleviation, whether we are talking in terms of food systems, in SDG 2, and whether we are talking in terms of education, whether we are talking in terms of urban development, whether we are talking in terms of environment, everywhere we find that health and nutrition ultimately are interlinked to those, and quite often there's a bidirectional element as well. So from an era of reductionist science, we are now entering into an era of complexity science, where we have to understand all of these linkages and try and elucidate them so that we can apply the appropriate solutions. Even quantum physics, the ultimate of reductionist sciences, which has even broken atoms into subatomic particles and then ended up with quarks, is now looking at complexity science as part of the entire quantum physics and looking at the quantum universe. So we really need to look at all the factors as a constellation of many complex adaptive systems. And these complex adaptive systems, whether it's environment, whether it is agriculture and food systems, whether it is health, all of these are coalescing or colliding with each other. And we need to understand those dynamics if we have to apply solutions. For example, agri-food systems are related to the environment, again bidirectionally. Climate change influences health systems, and health systems in turn influence climate change, again bidirectionally. Then we recognize that gender, education, and health, all of these are very much intrinsically interrelated. So changes in one can have an early visible impact on health, but can catalyze a chain reaction which can influence others. Like, for example, nutrition impacts health, which impacts education, which impacts occupation, which impacts income, and again, the feedback loop occurs. Now, we also recognize that if we pick up a few of these just as exemplars, if we look at economic development and poverty alleviation, which is the number one, we recognize that there is a bidirectional relationship between economic development at the population level and health of the population. We know from the Preston Millennium Development Curve that by the time per capita income rises to about approximately $5,000, where it starts plateauing off, till that time there's a fairly sharp relationship between life expectancy of the population and the per capita income of the population. But we also know that it's not just the per capita income or the rate of growth of the income in that population, but the equitable nature of distribution of that income that matters. We know from Spirit Level, published by Wilkinson and Prickett, that countries which have a higher level of income and social inequalities, particularly income inequalities represented by Gini index or other indices, have lower life expectancy at the same level of per capita income than countries which have a better equality index, which have lesser degree of income inequality. You just have to look at the OECD countries and look at the 8-year difference in life expectancy between USA and Japan. And indeed, we recognize that across the world, we find these differences quite clearly manifest. But even before Thomas Piketty wrote his treatise on inequality, we had R.H. Tawney, a socialist theologian, economist from the United Kingdom in the 1930s. In his book Equality, he writes that equality of opportunity is decorous drapery without equality of circumstances. Quote, with massive inequalities where many are denied an adequate education, unable to access effective health care, and housed in slums, equality of opportunity is nothing but more than a cruel jest, the impertinent courtesy of an invitation offered to unwelcome guests, in the certainty that circumstances will prevent them from accepting it. Well, his lordship, the feudal lord, could well invite the serf for dinner, but if the condition is that the serf must come in a tuxedo, then obviously the serf cannot make it. Well, basically Tawney says, what we need is not just an equal start, but an open road. That open road is created by a variety of other social conditions, and that we must pay attention to. Then we also recognize that health is subjected to the cumulative impact of assault by an assembly of adversities over a lifetime. And this is what really impacts the health of individuals as well as of families. And this multitude of inequities must be addressed, not only for that generation, but also looking at the impact which is intergenerational. Now, the intergenerational impact of inequalities is easily understood in terms of the social pathways. If parents are uneducated or less educated, if the parents are poor, then that poverty gets transmitted to the rest of the family in terms of limited opportunities, and therefore that we understand ill health also gets transmitted. But we now know that there are biological pathways of intergenerational inequality which are transmitted. We recognize the impact of what are called epigenetics, where genetic expression is substantially conditioned by the nutritional effects as well as exposure to a number of other elements, whether it's stress or pollution or other elements. And that carries not just for one generation, but carry across multiple generations. If we now know that if a pregnant mother is undernourished and a child in the early years of infancy is undernourished, that child is much more prone to develop adult cardiovascular disease and diabetes pretty early in adulthood. That's the epigenetic impact, where the genes are structurally not altered, but the gene expression is not altered. But if the baby in the womb happens to be a female fetus, the undernutrition of the mother affects not only that baby, but also the developing eggs or ova in that particular baby who is still in the womb. So it is not just the child yet to be born, but the child yet to be conceived who is affected by intergenerational inequalities. So unless we recognize these pathways, we will not be able to really ameliorate and address the issues of human development, which are indeed intergenerational in so many senses, both social and biological. So we now also recognize that there is a microbiome, that there are trillions and trillions of bacteria and other microbes that are living in our gut and over our body. And they are essential for our health, for immunity, for producing vitamins, and for guarding against pathogenic bacteria and microbes. And they really shape us. So when we refer to ourselves as the royal we are not only talking about ourselves out of arrogance, but we are talking about the various microbes who outnumber us and live with us. But their genes, along with ours, actually form the supergenome, which influences our body. So what we eat is also not only for us, but for the microbes. So if you eat a fiber deficient food, those microbes are going to rebel. And these are the important elements that we must understand as to how multiple determinants are so closely interlinked and are there. Then we must also recognize, when we talk of equity, that equity exists in two dimensions. Very often when we talk of equality of opportunity or equity, we talk of in terms of one dimension, horizontal equity, in which we say that every single facility that is offered, service that is offered, must be equally offered to everybody. But we also need to think of equity in the vertical dimension, where people have been deprived, people have been disadvantaged, have suffered the impact of those inequities. We need to ameliorate those gaps and ensure that even the opportunities that are not offered are not hindered by pre-existing and concurrent inequalities that exist. So that vertical and horizontal equity dimensions both have to be combined in any human development approach through public policy. So obviously when we're talking about something like a health insurance program, which may not be immediately universal for everybody, or a health assurance program in terms of financing, we not only have to look at certain services being available to everybody, maybe additional services or additional resources being provided for those who have been extremely disadvantaged, so that you can actually bridge the gaps. So this is absolutely required. recognizing and redressing vulnerabilities becomes a very important mandate for public policy. Now, we can, of course, talking purely of economic instruments, fiscal instruments are absolutely important. They act as a wonderful nudge. For example, raising tobacco taxes, raising taxes on ultra-processed foods, raising taxes on sugar-sweetened beverages. By increasing the cost of the unhealthy product, you can drive down consumption. And that can be very beneficial apart from raising tax revenue, of course, but that's the secondary objective. The important thing is to drive down consumption. And public policy can be very, very impactful in this area. Public policy, we can provide both incentives as well as disincentives, the carrot and the stick. Public policy is like a frozen carrot. It can be both the carrot and the stick. So, but we are often told that it's a matter of individual choice. You're creating a nanny state. You cannot allow the state to interfere with personal choices and liberties. Well, in a democratic society, choice is important, but choice does not occur in a vacuum. Choice is either conscious based on the right or wrong information. Choice is conditioned based on aggressive marketing and promotion and peer pressure. Choice is often constrained by economic conditions. Even if somebody knows that they have to consume 5 helpings of fruit and vegetable a day, they may not be able to afford it because of financial reasons, and they may not be able to afford to buy the healthier oils and may have to settle for the unhealthy trans fats. So we must recognize that public policy cannot be hindered by arguments of libertarian protests. Then coming to nutrition. Well, we know that nutrition is absolutely vital for health, but also through health for economic productivity, and therefore for progress of countries and for overall human development. Economic historian Robert Fogel, who won the Nobel Prize in 1993, wrote that improvements in worker health from better nutrition is a significant factor in the long-term economic growth. He estimated that half of Britain's economic growth from 1790 to 1950 was entirely because of improvement in the nutritional status, which impacted upon health and thereby on productivity. Of course, during the same period, Britain was responsible for the Irish famine and the Bengal famine. That's a very different issue. Our own nutrition was affected. But basically, this particular argument of Fogel has been very well described and dissected by Angus Deaton, who himself got the Nobel Prize in Economics later on, in the Journal of Economic Literature in 2006. And it's very clear that nutrition is one of the very important factors in human development, which drives health as well as other areas of human development. But we recognize that there are many phases of malnutrition. What was called undernutrition still remains, but what is called overnutrition needs to be redefined as inappropriate nutrition, because we are no longer talking about calorie excess. We are talking about inappropriate nutrition intake, which results in body adiposity, which is unhealthy. And also we are talking about micronutrient deficiencies. Even so-called overweight, obese people can be micronutrient deficient. And even thin people can have excess abdominal fat. 1/3 of India's diabetics are thin diabetics. And that's because of the kind of food that we are actually feeding them, or they're forced to feed themselves. So the whole idea of having crop diversity and nutrition dietary diversity becomes very important in our context, and there again public policy becomes very important. And as Sinhaji said, we are quibbling about what the standards are without recognizing that there is a real problem that needs to be addressed. It's time that we all recognize that India's national bird is the peacock and not the ostrich. Coming to education and health, well, with Vrindaji here and Amarjit there, I cannot really talk about the importance of education in human development. But let me quote from the Incheon Declaration of 2015 of how SDG 4 is vital for health. Quote, education endows the skills, values and attitudes that enable citizens to lead healthy and fulfilling lives and make informed choices. So if we are really looking at this, values, attitudes and informed choices and the impact of education on health, education enables greater access to health information, increased opportunities for higher income earning occupations and employment. Higher income leads to better living conditions, better homes, better sanitation, better water supply, better food of course. Education trumps income. That's a very important lesson that we must learn. Even at the same level of income, a person who is educated generally can access better health services and also take better self-care. And that is a very important element that we must remind ourselves. So even as we are fast-tracking education and trying to raise incomes, fast-tracking health and nutritional literacy becomes very important. Then education makes a person more has greater health-seeking behaviors, more adapted self-care, less addictive behaviors. Now, there is a definite inverse relationship globally between tobacco consumption and the level of education. Then there is a greater opportunity for participatory decision-making in healthcare, better insurance literacy, and now better digital literacy, which becomes important for health and development. So education becomes very important. Briefly, I'll touch upon also climate change and health. There is a great impact on vector-borne diseases, waterborne diseases, and zoonotic infections. Heat effects, extreme heat effects, extreme weather effects. The agriculture and food systems are impacted. Now we are already operating at the height of temperature tolerance of wheat and rice in this country. For every 1 degree centigrade further rise in temperature, in South Asia and Sub-Saharan Africa will have a 10% reduction in staples. And even the quality of food will be affected. The Data Sciences Center of Columbia University estimates that if the present conditions continue, India will have 49.6 million zinc deficient persons, 38.2 million protein deficient persons, 106.1 million children with anemia, and 396 million women with iron deficiency by 2050. So we have a huge challenge in terms of the impact of climate change on nutrition. At the same time, we know that food systems, as they are currently operating, are also aggravating climate change. There's a bidirectional relationship. Similarly, health systems, which are affected by climate change, are also aggravating climate change. 5.3% of global greenhouse gas emissions come from the health sector. 30% of that from the infrastructure and 70% from the supply chain. This may be less in India, but as we are now building up our own infrastructure, we have to make sure that we have both climate resilient and climate smart food systems and health systems. But public policy is not generated in vacuum. Enlightened policy needs scientific credibility, financial feasibility, operational scalability, and political viability. So it is the duty of research, the purpose of research is to provide evidence-informed, context-relevant, resource-optimizing, culturally adaptive, and equity promoting recommendations for policy and practice. This requires multidisciplinarity. It requires contextual knowledge, and that springs from communities, but also we need to bridge the gaps and the silos that exist between academia and ensure that multidisciplinarity really creates the wealth of knowledge that is required to inform and advance policy. So, we do require research that is done at multiple levels, but micro-studies, which Amarjit has spoken about, are absolutely important, because we need to understand what is happening and why it is happening, and what specific interventions work and what do not work at the ground level. And that experiential wisdom has to be generated from the community level. So we, on one hand, we do require for policy multidisciplinary research that bridges knowledge from multiple streams, even at the policy level, but at the implementation and operational level, particularly ground realities are required. So when we are really talking about complexity, we should not be deterred by that complexity. We have to find the solutions for that. And our approach must be like that of a modern camera. The camera has a zoom function which focuses very sharply on a specific thing and then finds what it is and tries to put a label and find the solution there. But it also has a panorama function which places everything in context. And therefore public policy has to take both of them into account. And if I may also quote a little from the Indian epic Mahabharata, without any religious connotations. Arjuna was supposed to be a brilliant warrior who, when Drona asked his pupils to aim at a bird, while others saw the tree or the whole bird or the wing, he only saw the eye. But the same warrior, when he was put in Kurukshetra, was unable to really launch into battle because he was uncertain what to do. So Krishna had to show the Virat Rupa, the cosmic configuration, and so that Arjuna could identify his specific role. So our business has to be that. We have to perform our specific duties in the right manner, but unless we understand the big picture, we'll not be able to position ourselves appropriately and perform even that to the best of our ability. So that fusion is absolutely important in public policy. So we also recognize that public policy, in order to make multi-sectorality a multi-sector reality, requires multiple levels of coalescence. At the highest level, at the policy-maker level, whether it's the Niti Aayog or the Prime Minister's office, at the mid-level, at the level of the civil service bureaucracy, and at the ground level, at the level of the functionaries, everywhere there has to be a very clear-cut alignment. But one of the important things that we must do is, people will continue to function in silos and sectors, because unless we show them what is a win-win situation, they're unlikely to exert themselves. They're unlikely to move beyond their sectoral mandates, beyond their policy and program deliverables, beyond their limited budgetary lines. Therefore, you will have to really point out the positive externalities as well as the negative externalities and show that if you act, then this is likely to benefit not only the other sector, but will loop back to benefit you in this manner. Otherwise, if you do not act, this is going to hurt you in this manner. So the positive and negative externalities of actions, each action, have to be clearly outlined, and I believe the book also must actually ensure that approach is taken so that you can actually carry conviction to people who are change agents in other sectors. So there is a price to pay for inaction and for incorrect actions. There is a price to be won for timely, relevant, and effective actions. And both of those need to be very clearly defined. And we now recognize that community and gun is a very important element. We have seen that from Thailand, we have seen that from Brazil, we have seen that even in Nagaland. In Thailand, we have the National Health Assembly as well as the local health councils. In Brazil, we have municipal councils who have monthly meetings in which they take, not only they look at accounts as well to see how the public money is being spent on various programs, and they can call the implementers into account. In Nagaland, we have seen the Communitization of Public Institutions and Services Act passed in 2002, and the health communitization committees, which include the Gram Buras and the village councils and other citizen groups. And whatever evaluation has been done has shown improvement in the provision and utilization of services and infrastructure for health. We have examples from Kerala, we have examples from Bangladesh of how good health has been achieved at low cost, and therefore everywhere we recognize that community has played a very critical role, and therefore we can only ignore the contribution of the community at our own peril, not merely to treat them as beneficiaries, but to ensure that they are active participants in developing policies and programs, in implementing them, in partnering in the implementation, in monitoring, and also in evaluating, and ultimately providing the correctives when needed. So it is that level of community engagement that is absolutely required. I believe that the public policy dialogue will address all of these issues and certainly come forth with the various volumes. I was interested in seeing Dr. Amarjit Sinha say 6 volumes will go to 12, 12 will go to 18, 18 will go to 24. He's dealing in sixes like Rinku Singh. 5 or 6 sixes straight away. Okay, good. So, in conclusion, Simone Weil said, "Attention is the rarest and purest form of generosity." Thank you very much for your gracious invitation and for your generous attention. Thank you.
Thank you, Dr. Reddy, for your thought-provoking address. The 3-day public policy dialogues, I think together we can and we hope we will. And then there is a blank space I leave you guys with to fill with your own ideas and your own aspirations. I would now like to request Professor Ashwini Chhatre to present a token of appreciation to Dr. Reddy, please. May I please request Dr. Jain to present a token of appreciation to Mr. Sinha, please. Can you all stand together for a group photograph? Thank you. Thank you very much. And with this, I would like to thank our plenary session members, Dr. Reddy, Shri Sinha, Professor Chhatre, and Dr. Jain. You can like this. Okay, so what's happening over the 3-day period, just to give you a quick overview, and like guys, I will keep it very, very brief. As I mentioned earlier, that we would be having several sessions, panel discussions and roundtables on the theme of improved nutritional outcomes, climate action and justice, improving learning outcomes in schools, panel discussion on, again, a human development perspective from states, and tonight we have a special program, Kavali Night, followed by dinner at the Recreation Center lawns. On day 2, which is tomorrow, we would start with panel discussions and roundtables on institutional challenges in social development, climate action and justice, livelihood diversification and skills, healthcare for all, institutional challenges in social development, and AI panel discussion on AI solutions for last mile healthcare delivery in rural India, and a similar roundtable. Discussions on diversity, equity and inclusion in tech industry. and which will also have a very exciting theatrical performance by Julie Weber and her team for a show called Aapki Saira in the same Khemka auditorium. On day 3, we would have panel discussions on data protection legislation in India, implications for health and research, and roundtable on healthcare for all. Then we would be back in this auditorium for innovation presentations and a roundtable, and followed by a closing plenary. So that is the agenda for the 3 days. I would now like to invite you all to a buffet lunch in the atrium, and we would be back in for roundtables and panel discussions. There are 2 separate locations on floor 1, AC3 LT on second floor for all the panel discussions, and AC8 boardroom again on second floor for all the roundtables. Post-lunch, the panel discussion is on improved nutritional outcomes, so you are all very, very welcome to attend. And if you also have interest in improving learning outcomes in school, then you can also join the roundtable, which would both start in different locations at sharp at 2 p.m. So thank you everyone, and see you all in different locations about an hour's time. Thank you very much.